spread.
Well, the coronavirus lockdown has forced millions of people around the world to stay at home. It might keep them safe from infection, but there are other risks that they have to deal with, as Nikki Aaron explains.
With billions of people around the world now in some kind of lockdown, there's growing concern that the psychological toll of such measures could prompt a new global crisis, a mental health one.
If we see it coming and we start thinking about it early and we start thinking about how we can tackle it most effectively, we've got a very good chance of mitigating the impact. This is a huge health crisis, which is going to have impacts not just on physical health, as we've heard so much about in recent weeks, but also, I think, mental health in the weeks and months to come.
Psychologists now say that people are increasingly seeking support as coronavirus forces them to stay home.
There's probably been about a 50% increase in the number of people looking for talking therapy since quarantine started in Ireland anyway. And it's because people are at home, people have time to think, people are worried about the future because of COVID, people are worried about their jobs, their relationships. You know, people are worried about what the world is going to be like after this is ended.
For some, the impact has been stronger than for others. Laura has been living with agoraphobia for almost 5 years. At her lowest point, even the thought of stepping outside of her front door would trigger an anxiety attack. She has managed to overcome her fears over the years, but with the order for people to stay indoors, Laura's now facing losing much, if not all, of her progress.
The avoidance behaviours, they can creep up on you if you don't keep on top of them. So because now I'm not able to go out and practice going in the supermarket, going out to eat, going to the pub, I can't keep doing those things. So I am quite worried, and I already know that I have started to feel anxious about the thought of going out. So I'm worried that I'm going to slip back into those behaviours where I just don't feel comfortable going out.
Social distancing has been highlighted as vital to halt the spread of COVID-19. But for those with mental health issues, from depression to conditions like anorexia, it's exacerbating an already stressful scenario. In the UK, a spike in the number of mental health incidents, including suicides, were reported to police in the first 2 weeks of lockdown, and it's warned this trend could continue. While in the States, one of the country's largest suicide crisis hotlines saw a 75-fold increase in calls in the past month. The prospect that the reaction to the coronavirus could be as deadly as the disease itself paints a grim forecast. And the distress is made worse by the uncertainty of how long the lockdown will last.
It's difficult that we don't have an end point, because often when people know when something is going to stop, if you think about people who are in prison or, sailors who are on submarines or on naval ships or people who are on the space station, they know when it's going to be over for them. They know when their end point is. They know when they're coming home. Use the supports that are available to you. Have a routine. Use exercise when you can, speak to people through social media, and really just take this as an opportunity to stay low, stay set, and just wait it out, I suppose.
Let's quickly bring